Did I tell you that? It's recording. There we go.
There we go.
Perfect.
All right, welcome everybody to another edition of our webinar series here tonight with Diana Lonzi and Stephanie Michele from Bradford Sports Medicine. I can see lots of people are streaming in right now, which is great. We got a huge turnout tonight, so this will be a lot of fun. It's from my time back on the webinars. It's been a little while since I've done one, but I think last year we did maybe about 8 or 9 webinars. We did quite a few.
You did a lot.
It was quite good. I guess we're going to get going in 3 or 4 minutes here. We'll let everyone kind of get organized. If you'd like to say hello or post something, a question, you can hit the chat button at the bottom. Just remember when you use the chat, there's a feature to just send a question to just the panelists or to everyone. You can do what you'd like to there. But I guess first of all, this year is the Olympics coming up here in the next couple weeks. So I guess I'd throw a question out for everyone who's listening right now. What sport do you like watching the most at the Olympics? Let's put that out there.
What's your favorite?
Type into the chat, everyone, if you're type in what sport you like to see the most, and then we'll see what everyone's got. I'll type in mine. Okay, we got a curling coming in. That's great.
Oh, good.
Skating.
Skating. Oh, I love skating.
Yeah.
I'm gonna put in, I really find ski jumping to be
Okay.
one of the
Super
most
fun.
interesting.
Yeah.
I'm gonna put in ski jumping.
Cool. Anyone have hockey up there? Gotta go with hockey.
Hockey, yeah.
Although so heartbreaking, our NHLers are not going.
Yeah, I know. Hi, Jackie. I see your question there. We'll get to that as we go along. So don't worry. I've read that question. You throw in the chat, no problem. We'll talk about that later in the presentation. So what do we got here? We got ski jumping, swimming, tennis. Okay, so good summer sports. So Winter Olympic stuff here. Oh, bobsledding, yeah.
Luge, skeleton.
Oh yeah.
Snowboarding, border cross. Those are all
Oh, border cross. Super cool.
Yes.
Super cool.
Skeleton, eh? Is that the one where they're just like head first going down?
Yeah.
Yeah.
I had a friend
I'd like
who
to.
went into Calgary who did that skeleton.
Really.
You have to.
I'm really interested to see how the Olympics go this year, and I really hope Canada does well.
Yeah.
I think it'll be a great distraction for a lot of people now, finally, to maybe some normalcy in life. Maybe we can unite as a country again.
Yeah.
Watch something pleasant on the news for a change.
Yes. That would maybe be the headlines for the next couple of weeks, which would be a nice relief. So yeah, no, I'm looking forward to that, and you never know, right? Canada usually does really well in the medal count, right?
Yeah, usually in the winter games for sure.
Yeah, no, it's good. All right, I think we've got quite a few. We got another minute or two here. Let's give people a few minutes to get on here. Welcome to everyone who's joining us right now. If this is your first webinar, welcome. We've been doing these all of last year. You can certainly go to our websites, which we'll show later on. There's a tab on the websites where you can view our previous webinars. There's a bunch of different topics. So if you're looking for something to watch one day, one evening, feel free. There's a whole library of our webinars that you can go back and look at. We've been doing these now the past year to try to get interesting topics out to everyone for things that apply to them in everyday life. And tonight is one of those examples with osteoarthritis, which is one of the most common sort of disease processes in the world and affects a lot of people. So we're excited to be able to help all our patients get through osteoarthritis, and obviously the GLAD program that Diana is heading up at the clinics is quite a program, and she's going to speak a lot about that this evening. So I think maybe what, there's people slowly streaming in here, which is great. Again, everyone, if you're new to a webinar, you can simply type into a chat a question. There's a little drop down bar. It shows you if your message will go to everyone, hosts and panelists. So feel free to type in a question. I will be sort of moderating the session, so I'll be in the background, just having a look at all the questions coming in, and I might type some responses back to you then, and I'll just help the presentation along here in the background. So without further ado, I think we can get going here. So the GLAD solution to osteoarthritis. Let's move on to that first screen, Steph. Again, here's that little example I was showing everybody, or telling you that you can go in, figure out where from the chat, if you want to select everyone or just the panelists, you can type your question in there. Okay. Moving on. And I'm going to just hand it over here. I'm going to disappear in the background, but I wanted to introduce Diana Lonzi, our registered kinesiologist at the office. She's in all three of the offices, Bradford, Aurora, and our Nobleton office. And she takes care of all the GLAD programming and a new program coming up here, OsteoPro, which she's going to speak briefly about. And secondly, welcoming Stephanie Michieli, who's our clinic director at our Bradford office. She's been a registered physio for a number of years and very highly skilled manual therapist. So everyone is in good hands tonight. You're going to get some great information. So I'm going to disappear, and I'll pop in here and there with some questions. And without further ado, Diana and Stephanie, it's off to you.
Thank you.
Thank you. Yes, so just a little bit about myself. So I went to York University and I studied kinesiology there. I graduated in 2019 and I then became a licensed and registered kinesiologist. I had taken on a unique role at the clinic. I started off in custom bracing and got to know more about osteoarthritis as a disease and how it affects the joints, specifically the hips and knees. And then from there, I've also developed a program for osteoporosis, and I am also, as Mike had mentioned, the GLAD program instructor and director. And off to my lovely colleague, Stephanie.
Thanks, Diana. I'm Stephanie. Nice to meet you all. I am a registered physiotherapist and clinic director here at Bradford. I graduated from Western in 2013 from kinesiology. I went back to Western for my physio degree and graduated in 2015. And then I didn't get enough and went back to Western yet again in 2018 to do a master's of clinical science in manual therapy. I have been working with Aurora Sports Medicine since 2017. And then when we opened the clinic here this past summer, I came over as clinical director. And so we've been open for 6 months now and we're doing great. We're glad to have Diana aboard running all these programs. And yeah, we're having a great time here. So Diana, would you like to take it away and tell us what we're going to learn about tonight?
So tonight we're going to be talking about a few main topics. So our first topic of the night is what is osteoarthritis. Our second topic will be the common signs and symptoms of osteoarthritis and how it presents. It is different in everyone. The third topic is what are the current treatment options that are available for osteoarthritis. And then we're going to get into what you all hopefully came here tonight to learn more about, which is the GLAD program or Good Living Arthritis Denmark, how it can help, and a few key exercises you can start today. And then we'll go into our Q&A. And then we also have a fun giveaway. So make sure you stay tuned and watch the whole presentation in order to win the giveaway.
For sure. That's always the best part.
Yeah, it is.
All right, so we have a poll. Mike's going to put up a poll for us. We just want to see who's here with us tonight. So hopefully that poll is going up. There it is. You guys can take a minute or so just to answer a couple questions about yourselves, just so we know who's with us here tonight. and we should see the answers
Yeah, I
coming
just
in.
got it going there, Steph. It's up, right?
Yep, it's up.
So,
Yeah.
yep, the answers are starting to come in now. So we'll give it here a minute or so, and
For sure.
then I'll post the results here.
Oh, cool. Thanks.
All right. So yeah, some quick questions. Just we want to know our audience, age of everyone, if you've been diagnosed with osteoarthritis, where it is, and have you heard about the GLAD program? So this is good. Just about done. I'm gonna let a few more answers come in here. It's great. We got high amounts of participation on the poll. It's great.
Love it. Everyone's engaged at the beginning. It's great.
Yeah. Okay. Well, they're still trickling in here. Okay. All right, let me end the poll and we'll pop that up here.
There you go.
Share the results and let me know. You can see those results there, Steph.
We can, yeah.
Yeah.
Good,
So-
yeah.
So it looks like, you know, a fairly diverse age range here.
Mhm.
Most people have been diagnosed with osteoarthritis.
Yeah.
A
Lots of knee.
bit of a
and hip.
variety there, eh?
Yeah.
Yeah.
A little bit of both.
Oh, good. Lots of
And
people are learning about the GLAD.
some
program.
people have heard about the GLAD and others, there's a lot that are waiting to hear. So that's great.
Yeah, that's good. Awesome. All right.
All
We
right.
have a variety of people. Hopefully everyone will learn something new tonight.
Yeah. All right. Go. You can move on there.
All right. Oh, gotta get rid of the poll. All right. So I'm going to talk to you tonight about arthritis, specifically osteoarthritis. But first I'll talk about just arthritis in general, which is the swelling and inflammation of one or more joints. This term describes many conditions that affect the joints and the tissues surrounding the joints. So specifically tonight, we're going to talk about osteoarthritis. It is the most common form of arthritis, and it affects more Canadians than all other forms of arthritis. It affects 1 in 7 adults and about 4 million Canadians. It can affect any joint in the body. However, it most commonly affects our weight-bearing joints, our hands, our knees, our hips, and their spine. Osteoarthritis has often been referred to as wear and tear or degenerative joint disease. However, in more recent years, the Osteoarthritis Research Society redefined it as osteoarthritis is the result of the body's failed attempt to repair the damaged joint. So osteoarthritis is a progressive disease that affects the whole joint, leading to the breakdown of the joint cartilage and the underlying bone and connective tissues of the joint lining. So here we can see the cartilage. It's a nice, hopefully you can see my cursor moving, but it's a nice firm, slippery tissue that covers the ends of the bone. And here you can see the affective joint, and you can see that there's a cartilage loss, and then there's some other changes going on in the bone and in the joint, and I'll talk about that on our next slide. So a joint with osteoarthritis will demonstrate some of the following things. So again, we are noticing the damage to the joint's cartilage, as you can see here. Bone spurs form around the edges of the joint. These are also termed osteophytes. You can actually sometimes feel these when you're feeling your knee joint, or not so much the hip because that's quite a deep joint, but around the knee you can feel some of these bone spurs sometimes. You'll get swelling of the joint due to that inflammation of the whole joint. And there will also be decreased synovial fluid, and the synovial fluid is what fills in the joint here, and it lubricates the joint and allows for a smooth gliding and allows for shock absorption. And then because we mentioned it affects not just the cartilage and the bone, the whole joint, you'll also notice that the ligaments and the tendons can be affected and they can break down a little bit as well too. And it's good to note that this doesn't happen all progressive and it's not all severe. It can have varying degrees of each of these things. So that's the basis of the pathology there. So the common signs and symptoms, a joint with OA will demonstrate the following, and they often develop slowly and they'll worsen over time. So pain is the main thing. That's probably what brings you here to physio or to the GLAD program or to see your doctor. The pain in the joints may occur during movement or after movement. And as the disease progresses, it can be triggered by everyday activities, and you can even sometimes feel it at rest. Swelling is another common finding, and that's due to that inflammation of the soft tissue in and around the joint. Then we will have stiffness. The joint may be stiff after a period of immobility. So you might notice this when you first wake up in the morning, or if you've been sitting for a long period of time and then you go to stand. That's a common thing that we'll hear from our patients when they're talking to us about their arthritic joints. And the stiffness usually lasts for about 30 minutes or less. That is a key kind of finding for osteoarthritis. So that's something that we keep in mind, that once you do get moving, it usually feels a little bit better. And there's also a loss of motion or a loss of flexibility. So you might not be able to move through your joint's full range of motion. You may notice, for instance, in the knee that you cannot fully straighten it or you can't bend it. And this may affect your everyday life. You might have difficulty, getting in and out of the tub, or going up and down the stairs, or getting into a deep squat. When it affects your hips, a common sign we'll hear from people is they have trouble putting their shoes and socks on. So they can't lift their hip up and turn it out, or they can't get into the car because they've lost some of that motion. Also, there'll be some tenderness. As I mentioned, we had those bony osteophytes. And so if you apply pressure, or you palpate your joint, so on that joint line, or your physios will do that for you. And oftentimes you'll be quite uncomfortable because of that tenderness there. And sometimes you'll hear some noises or a grating sensation. You might hear a little bit more popping, clicking, cracking, and those nice noises in your knee as well too. So osteoarthritis is diagnosed both by those symptoms we just mentioned, but also x-rays are the gold standard. On an x-ray, cartilage does not show up, but it shows up as this negative space here. So we can see in this joint, it's nice and smooth, and that there's negative space. That's showing us that there's some healthy cartilage. On an osteoarthritic joint, we can see that there is a loss of joint space, and joint has narrowed, and that is indicating that the bone has lost some of its cartilage, and that's an osteoarthritic knee. You can also see some of these osteophytes we were talking about, so those sharper bone spurs there as well. So that's the gold standard, is the x-ray. There are some risk factors that increase your likelihood of getting osteoarthritis. Older age is one of the risk factors. However, it's not an old person's disease. Lots of people in their 40s and 50s, who we would consider young, can get osteoarthritis. Another thing that predisposes you to osteoarthritis is having a previous joint injury. Even injuries that have occurred many years ago when you're a kid and that seemingly have healed can slightly increase the risk of osteoarthritis. Obesity and being overweight is another risk factor. Carrying that extra body weight can contribute to osteoarthritis in several ways. The more you weigh, the greater the risk. Increased weight adds more stress onto that joint. Also, there are some metabolic conditions that occur with being overweight. There is more inflammation, and there are some diseases that occur with obesity, such as diabetes, and these can lead to osteoarthritis as well. Additionally, having a heavy physical activity, playing a more of a rougher competitive sport, or having a job that causes repeated stress on the joint can also lead to osteoarthritis down the line. And then genetics, those are a big factor as well. So if you have a family history of osteoarthritis, mom or grandmother, dad, there is a chance that you could also get osteoarthritis in your future. And sometimes just even your sex can affect osteoarthritis. So if you're a female, there is a higher risk of having osteoarthritis. Not exactly sure why, but it is a risk factor. All right, so that was the breakdown of osteoarthritis. We do have another poll to find out if anyone is aware of treatment options and maybe what they are currently doing if they have osteoarthritis. How are you currently managing it?
Now.
Yeah, I believe it's up there if you guys can see, and
yeah,
tell us what you're doing right now or not doing and want to learn about.
Yeah, there's plenty of choices to help manage it. It's aside from awaiting for surgery, there's plenty of options for people for sure, which I think most aren't aware of, or maybe they've heard of one or two. So
yeah, hopefully they learned of it tonight.
Yeah, exactly.
Mhm. And we made this a multiple choice, so hopefully, people
Yeah.
are doing a few things, right? Not just one.
Yeah, exactly. All right. I'm gonna end it there and you can see the results
Mhm. Everyone can see that? Yeah. So
coming up.
yeah, good. I mean, we love to see that people are doing physiotherapy and exercise, of course. That's what we're here to talk about mostly tonight. That's great. All right, bracing, injections.
Yeah.
Good, kind of a mixed bag. All right, on to our treatment options. So I'm going to take you through a few different treatment options tonight and give you a rundown of some of the options out there for you, but it sounds like a lot of you are quite aware. All right, so we'll start with medication. Often medication is the first line of treatment and it's often prescribed by your doctor. There are a variety of types. Over-the-counter non-steroidal anti-inflammatories or NSAIDs. Over-the-counter, we have our ibuprofen, so that's your Advil. And then naproxen sodium is the Aleve. I know that was a big ticket item in the past couple of years. I remember before they brought it to Canada, everyone was going over the border to go pick up the Aleve because it helps so much with the arthritis. Then there are prescribed medications. So some people may require anti-inflammatories that have a stomach protector or that have a higher intensity. So they get prescribed medication from their doctors. Commonly we see in the clinic Celebrex or naproxen. Those are the ones we hear. And then acetaminophen, also known as Tylenol. That's another another type of drug. It's not an anti-inflammatory, but it works on the pain mechanisms. Tylenol arthritis is typically prescribed by your doctors, but it is an over-the-counter version as well. And then for those of you who may not want to ingest any medication, we do have topical creams available, and there are a wide variety. You can get the natural ones. You can go to Nature's Emporium and get like an arnica or a CBD. And then there are the ones that are made of like anti-inflammatory drugs as well. So we have our Voltaren, our Rub A535. And then there are topical compounds that you can get from a pharmacist that have a variety of medications as well too. And those are just a great option to treat locally at the source without having to ingest any medications. And then we have custom bracing. Bracing can be used to effectively unload and reduce pain in the unicompartmental OA of the knee. So here we have a knee that we're looking at. And you can see on this X-ray, if my cursor is working, that this inner portion or medial compartment of the knee is showing a loss of joint space. And so we have some compression and loss of cartilage here. And that has also created a malalignment of the joint. So we would consider this leg a little bit more bow-legged, or as we term it, varus. And so this brace here is a 3-point leverage system. It's made by Össur, which is able to unload the affected joint here. So it works by pushing pushing from this side and then pulling from this side to unload that joint and hopefully create more neutral alignment. And that will open up the joint. You can see that this person now has an X-ray with their brace on, and they've opened up their medial compartment there. So these braces are economical and effective in reducing pain, and they improve the quality of life. And because they've now unloaded this joint a little bit, it can potentially delay the need for surgery and progression of the disease. Braces are recommended for mild to severe osteoarthritis, but work most effectively when you only have the osteoarthritis in the one portion of the joint, because you need something to borrow from to open up on the other side. And again, Diana is our bracing guru here. So at the end, if you want any more information from Diana, she'll be the one to chat about. So if you have any questions about that, make sure you type that in the box for Diana. And then we have a hip bone loader. So this is a little bit newer on the market. This is again done by Össur. This brace is designed to improve activities of daily living. I have it back here sitting behind me, just showing off. So this one is designed to improve your activities of daily living. You can actually wear this brace under pants. You don't just have to walk around in these beautiful shorts. But again, it uses a leveraging system to unload this joint here. It will externally rotate the hip to create better contact, put that joint in a more loose position, and make sure that you're not wearing down that affected surface. This is more effective in our mild to moderate hip OA. It may not be as effective in our more severe osteoarthritis. Okay. So we're going to talk about injections. So the last couple things were more minimally invasive, and injections, not that we would consider an invasive surgery. You do have to stick a needle in your knee, so they're mildly invasive, let's call it. So cortisone is our first injection. It is a corticosteroid. It is intended to relieve pain temporarily, so the relief can last several weeks, and it is cost effective. It can be done in a doctor's office. We have 4 doctors on our team who can do cortisone injections. So it is quite effective, especially if you have lots of pain and inflammation. And then we have Visco Supplementation. So in osteoarthritic knees, the synovial fluid, which lubricates the joint and cushions the joint, tends to break down. The synovial fluid is made up of many molecules, but one of the main ones is this hyaluronic acid. You may have heard of this. It is in my face cream. It is good to moisturize, but it also is part of your synovial fluid. So these gel injections, or Visco Supplementation injections, will inject this hyaluronic acid into the knee, and it's intended to act as a joint lubricant to relieve the pain. So it doesn't have any anti-inflammatory properties like our cortisone, but instead it acts as like a grease job, a lubricant to help restore that natural gliding motion and help with that cushioning of the joint, which in turn will relieve pain as well. It is longer lasting. This can last several months. People seem to have really good effects with this. However, it is a little bit more costly than your cortisone. So just something to keep in mind. However, many insurance companies do cover this if you have a prescription from your doctor. And then our last injection we'll talk about is our biologics. N-Stride is the one that Dr. Gamble offers in the clinic. It is an autologous anti-inflammatory protein. It is a bit of a tongue twister. I've had to practice that word a few times. So autologous means that it comes from you. So the doctor will take a sample of your blood, and through a special process, they'll spin the blood to extract certain molecules. So in an osteoarthritis knee, we have inflammatory cytokines, and they would be considered like your bad proteins, and they cause the inflammation, and they outnumber all of the anti-inflammatory or good chemicals in the knee. So when the doctor takes out the blood and extracts it, they'll separate the molecules so that they can inject the good anti-inflammatory molecules back into your knee. And this can help reduce or slow the progression of osteoarthritis because they're trying to block the inflammatory process in the knee. This is a great option. It can help slow down that progression of osteoarthritis. However, it is a little bit more expensive, but it is really good for some of our younger patients who are just wanting to slow down that progression. Now, Dr. Gamble does an excellent job of explaining these, probably better than I can. And he has done a webinar with Mike and Giacomo, our other 2 clinic owners and clinic directors. And I have a little arrow going to the webinar video there that if you'd like to watch that, that's on all of our websites. So please take a look for a much more detailed and maybe a little bit more competent explanation of those injections.
Hey,
And
Steph,
lastly,
can I just pop in with just we had a question here.
Sure.
Joanne put a question out. How many times can a cortisone be injected in a joint? I mean, that's been a common question. I think we get as physios all the time. People are worried about how many times they can get injected. I mean, I don't think we can sit here equivocally and give an answer on that because it's out of our scope of practice.
Yeah.
But I do believe that you can have multiple injections into a joint with cortisone without major risks. Certainly, this is something you would talk to your physician about, just to make sure, obviously, with everyone's own personal health situation. But I do believe you can have multiple injections.
Yeah.
The exact number, I can't tell you, Joanne. You would talk to a doctor about that. Okay. I know for sure in that webinar we did with Dr. Gamble, he does talk about that. So
Yeah.
I would certainly recommend people watch that a little bit too. All right.
Awesome. Thanks, Mike.
Yep.
And lastly, we have surgery. Surgery is reserved for advanced osteoarthritis when there's significant pain and decreased quality of life. We would consider these surgeries a quality of life surgery. So there are a few different surgeries. We'll talk about the knee in this case. So the partial knee replacement, it's an option for those who have significant osteoarthritis in a single compartment of the knee. So again, similar to that brace, we're talking about this portion of the knee where the other side is relatively preserved. So the damaged portion of the joint is replaced with our metal and plastic components, and the healthy cartilage, bone, ligaments that remains is untouched. So the advantage is that it is a bit of a quicker recovery. It's less invasive, so there's less surgical risks. And oftentimes, because the remainder of the joint stays, many people describe that it feels like more of a natural knee to them. They can maybe get a little bit more bend out of it. There is faster healing times as well with that, which is great. The disadvantage would be that only one portion of the knee has been replaced, so there is a potential for the rest of the knee to catch up, so to speak. And so if this portion of your healthy portion of your knee eventually does wear out, if you would call it, and forms more osteoarthritis, you may have to change your partial knee replacement to a total knee replacement. But this is a good option, especially for our younger osteoarthritic patients who have osteoarthritis in just locally in one portion of their knee. And it is reserved for specific patients, like I said, but you do have to have intact ligaments. That is one caveat to making sure that this is an option for you. Then we have our total joint replacements. This is reserved when the pain is severe and physical function is severely impacted. Total joint replacements are safe and they're effective to relieve pain and to correct the alignment as well. And they will help you resume your normal daily activities, which is the goal. Total joint replacements, and they're also termed arthroplasties, and that's when the damaged portion of the bone and the cartilage is removed and replaced with that metal and plastic components. And the metal portion can be cemented in, or it can be just fit in nice and tightly. And then, like I said, we have these metal components. In the hip, you might actually have ceramic or plastic as well too. And again, Dr. Gamble will do a fabulous job explaining all of this in that other webinar. But our focus here too is also the rehabilitation. That's more my bread and butter for sure. There is an extensive rehabilitation after surgery. So you have to remember that, yes, it's going to help with your pain, but you have to do the work afterwards as well. It usually takes about 6 weeks or so to resume your normal activities of daily living. So that's where you'll switch from using a cane or a walker to hopefully walking a little bit more normalized. However, we do like to remind our patients that it can take up to a full year to fully recover your mobility and your strength. And we do recommend seeing a physiotherapist throughout your process to help you regain all of your strength and your function. And last but not least, physiotherapy. We use a variety of treatments to help restore your mobility and your function, to reduce your pain and your swelling. Manual therapy is something that all of our therapists here at Bradford, Aurora, Nobleton, that we all do. As you can see in the photo here, the gentleman's using his hands to help restore some knee bending. Soft tissue massage, soft tissue work, that can help with swelling and inflammation. It feels really nice too, and it can help restore your motion. We do have electrotherapy modalities. You may have heard of ultrasound or TENS, Dr. Ho as they call it. And then we have cryocompression. So in our clinic, we have this cool unit called the Game Ready that circulates cold water and compression. So that can help with your swelling as well, help with the pain. Several of our therapists are trained in acupuncture and dry needling. So that can help with some of the pain that you're feeling, the inflammation, tight muscles. We can also offer assistance with assistive devices, canes, walkers. We have a chiropodist who works at our 3 clinics who can offer some help with orthotics or heel wedges to help with your alignment issues. Diana, as I mentioned, is our person who does all of the bracing. So all of those assisted devices. And then exercise. Exercise is definitely the big ticket item that us as physios prescribe, but then now we have this lovely program called GLAD, which is run by our awesome kinesiologist, and she will talk to you about all of those exercises that will help you.
Thank you, Steph. Okay, so we're going to start with a poll. So Mike, I'll get you to put that up when you get a chance there. Perfect. So just take a few seconds here, fill out the poll that we have, just so we have a better idea of kind of what you're doing now, and then we'll start to talk a little bit more about the GLAD program.
Yeah, I mentioned on the on the chat here, I had a few questions. People were just commenting. Some folks there have got some braces. They're getting great results. One person has an OSA brace and mentioned that it's really delayed her surgery now for years, which is great. And I find the OSA braces have been amazing for some of the patients that I've put them in. You know, the combination, whether it's injections and bracing, seem to help a lot of people. So, you know, there comes a time when the joint will start to deteriorate so far that, you know, all our conservative choices, you know, run out, and then you do end up needing that arthroplasty or replacement. But the technologies are so amazing nowadays, and you know, we've got some great physicians out there doing this. So
especially with a lot of younger people, we want to preserve that knee as much as we can, right? So
all right, so here are the results here, guys.
Okay. So quite a few people that are limited with their function. Okay.
But lots of exercisers, that's great.
Yeah, lots of people in an exercise.
We love that.
Okay.
Look, we got people, there's 7% that want to start right now, some exercise.
Awesome.
Good.
Send me an email. We'll get you started.
We'll get you started. You're in the right place.
Okay. So Good Living Arthritis Denmark, also known as GLAD, made for Canada. So we are going to briefly discuss the history of GLAD. So the D in GLAD stands for Denmark. It had actually originated in Denmark back in 2013. The whole main reason why the GLAD program was created was because there was quite a few people that were taking sick time and were off work due to their osteoarthritis. So they decided to design this program to help reduce that time and costs on the healthcare systems. And they had great results. So over 30,000 people were followed that did the GLAD program in Denmark. And quite a few of them had a significant reduction in symptoms. Over 32% of people did have a reduction. So from there in 2016, the GLAD program started in Canada. It actually started in Alberta. And we saw very similar results as Denmark did. And that's kind of how the GLAD program came about in Canada. And there was over 45% of individuals, they had experienced an improvement in their quality of life, and over 30% of individuals also had a reduction of pain, which was very good as well. You can go to the next one. Perfect. So how can the GLAD program help you? So there are the key main reasons why the GLAD program can help you are reduction of pain. You can increase your function and your physical abilities, and also, you know, being able to go back to work, not having to take as much time off. And the key thing too about the GLAD program is that they don't want you to just, you know, be exercising for a certain amount of time while you're doing it. They want to really create this lifelong habit and positive lifestyle change, because that's really the only way we're going to help preserve our joints, is making this, you know, not just a few times a week that you're coming in, that it's actually going to be a lifestyle change that you're going to be doing. And they did see after 12 months in a post-program follow-up that there were quite a few people that had exercise adherence. So they stuck with the exercise and they really enjoyed it. And they also were able to improve their quality of life. Perfect. So what is the GLAD program? So we have exercise and education. So there are 12 one-hour exercise sessions that we go through over a course of 6 weeks. The total time is 7 weeks because I build in the education sessions. So typically we start off with a couple exercise sessions, get your foundation well with those, and then we go into our education session, and then we pick back up with the exercise. You are supervised in a clinical setting. So typically without COVID, you would be in our clinic doing it, and it is supervised by myself. And right now with COVID going on, we do run it virtually. So it is supervised online, and then I have a rotating schedule where each participant would come in, and I would just kind of assess and see how you're going with the exercises and go from there. And then the 2 education sessions, they're both 90 minutes in length, and we do focus on the osteoarthritis as a disease, other options for treatments similar to what Stephanie has mentioned so far this evening, and then those lifelong changes that we can implement into our daily routine to help preserve our joints further. Okay, so the main component of GLAD is neuromuscular exercise. Now, quite a few people probably don't know what that is, and neuromuscular exercise really just focuses on proper joint alignment, proper quality of movement, and joint control in all planes of movement. And you'll be educated to help maintain those habits in your daily activities. So it's not just while you're doing exercise, it's how we can properly move our joints when we're getting out of the car or picking up groceries off the ground, shoveling our driveway, climbing a ladder, those types of functional activities that we're doing during the day. So GLAD consists of the warm-up, circuit training, and a cool down. Okay, so our warm-up is 7 to 10 minutes long, and we're either on a bike or walking around the gym. Typically, we want everyone on the bike, but as Steph mentioned earlier, sometimes we can have loss of joint range of motion and movement. So you might not be able to actually get a full pendulum in on a bike. So that's where I would have a participant walk around the gym to do their warm-up. If you're at home, you can either do your walk around the block beforehand or use a treadmill or bike if you have a home gym. And that's when we're doing it virtually. And on to our circuit training. So our circuit training consists of 4 main phases. So there's quite a few exercises in each phase. So the first phase here is core stability. So in order to help support our peripheral joints and our properly, we need to have really good core stability. So we start with those, and then we go into postural orientation exercises. So that's keeping the weight well placed over our joint lines. Then we go into our muscle strength. We do lower body strengthening exercises, so for our legs. And then we go into our functional training exercises, which are more related to our daily activities. And I'll just get you to go back quickly. Sorry, I forgot a point. And each exercise is done in 2 to 3 sets of 12 to 15 repetitions. And you are closely monitored while we're doing this. The program shows like stations of exercises, but each exercise is modified individually to yourself. So though it might not look like it's specifically tailored to you, it actually is. I modify each exercise so it's at a level that you can do, whether it's an advanced level or a very beginner level. Okay. And we go into the cool down. So our cool down is the last 5 to 10 minutes of the class. We focus on safe stretching of our large muscle groups. And then we also focus on a walking exercise. And the reason why is that as soon as we start strengthening our joints and getting more mobility in our joints, the alignment of the affected joint with the osteoarthritis is positioned differently. So we actually have to re-practice our walking to make sure that we are not at risk of falling or getting injured. Okay, so on to some exercises you can start today. So I know we've been talking for a little bit while now, and we'll get moving. So our first exercise that we're going to do, and you can actually do this seated, is a knee extension. So don't worry if you don't have a band with you. Basically what you're going to do is a knee extension. So you would secure your band or your yeah, you would secure your band to the leg of the chair, and then you would contract your quadriceps, which are the muscles at the front of our legs, and bring that toe to the ceiling. You're going to complete 2 to 3 sets of this of 10 to 15 reps on each leg. And just a few key points while we're doing this exercise is that we want to ensure we have a neutral spine. And we also want to make sure that we wrap the band, if you have a band, around the top of your foot to secure it, so we are not risking the band coming off our foot. And you want to lift your foot up to the ceiling. So you can do that quite a few times there, about 10 to 15 reps, and then you're going to switch legs. So that is our knee extension. Our next exercise that we're going to do is our seated hamstring curl. Now this exercise works the back of our legs, that large muscle group, our hamstrings, and which helps support our knee and our hip. And you're going to do the same thing. You'll complete 2 to 3 sets of 10 to 15 reps on each leg for this exercise. This exercise, you want to make sure that that band is secured to a pole or somewhere like a table or a bed foot. That way it doesn't risk the band coming off when you pull your heel back to your bum. And then some key points we want to ensure, like I had mentioned, keeping that band secure, and we want to sit near the end of the chair so we can get that full range of motion. Excellent. And the last one that we're going to do, and we can all do this together if you have a stationary chair, as Steph is showing in her video. So we're going to do a sit to stand. So our sit to stand functionally moves into a squat. So that word squat might seem slightly intimidating, and you might feel like you're not be able to do it, but one of the earliest phases of the squat is sit to stand. So what you'll do is 2 to 3 sets of 10 to 15 reps, and you will have your feet shoulder width apart, arms across the chest if you can. If you need to put your hands on the chair, you can, to help assist yourself get up off the chair. And then easiest way to do it is have yourself seated near the end of the chair, and you'll try to stand up without any assistance, as Steph is doing a very good job showing. Thank you. Okay, so why GLAD? The reason why is because it's actually a clinically proven program. As I had mentioned earlier, it started in Denmark. When it came to Canada, specifically in Ontario, they conjoined with UHN, University Health Network in Toronto, and also with Bone and Joint Canada and the Canadian Orthopedic Foundation. And they have had really good results. Since the implementation of the program, there's over 209 GLAD sites, our clinics being 3 of those. And there's over 1,000 healthcare professionals that have been trained in the GLAD program. So it is a very reputable program, and people have seen really good results with it, especially when the program is fully completed. The whole emphasis is being able to do the full 7 weeks of the program. And then what to expect. So before you come in for the GLAD program, you do need to have an assessment done by one of our physiotherapists in-house. And then usually you'll start to see results within 2 to 4 weeks from starting the program. I believe that was a question in the chat that might have popped up. So what I've seen so far in the classes that I've run is that people have noticed a difference. Everyone's difference, whether it's mobility, less pain when they wake up in the morning, less joint stiffness. It varies because everyone's arthritis is very different, but everyone has seen some sort of result from the program. Also, what to expect is adjusting to that new joint alignment. It can feel a little bit weird and uncomfortable the first few weeks, but overall you want to focus on the positive benefit, which is having an improved quality of life and function. Excellent. Okay. Amazing.
All right. Just one other question there, Diana. Someone asked about using their brace while they're doing the exercise program. I'm assuming that that does occur. People can use their Oster brace, for instance, while they're working out.
Yes, absolutely. You definitely can, especially during the beginning. You might feel, going through the program, you might not want to wear it as much, which is an amazing improvement. But yeah, you definitely can use the brace during the program.
Okay. So while this is up here, we're gonna just get into the question and answer period a bit here, folks. and the prize giveaway. And we should, I think wrap up in the next sort of 5 to 10 minutes. So feel free, start typing in some questions here in the chat. Steph and Diana will keep an eye on that, and they can address some of these questions as we're going along. One thing I can recommend to everyone, so Steph, you can go to the next slide.
Yep.
If you want to get a little bit more out of the session from tonight, feel free to type into the chat one of these options. If you want to learn a little bit more about bracing, write in bracing. If you want to learn a bit about injections, type in injections. If you want more details on GLAD, including pricing, etc., I think it's better to provide you that information in hand. Type GLAD in, or if you want sort of an info sheet on all these topics, type all. So into the chat, feel free, type in one of these 3: bracing, injections, GLAD, or all. Okay. And, it's a great way for us to get you the information that you are looking for based on some of the topics we spoke about tonight. There'll be a little info sheet that comes to you on some of this, on some of these programs and such here. And we can certainly help you out with anything you need there. So again, bracing, if you want info, injections, GLAD, or all. Okay. And we'll get in touch with everyone there.
Yeah.
A
couple questions.
Yeah. Do you want to hit up a question there?
Sure. Yeah. So someone had asked if when doing exercises, if the knee clicks, is that damaging it more? And generally the answer is no, as long as your clicking is not painful. Clicking is very normal. We have gases in our in our joints, and you saw that there's that fluid in the joints, and oftentimes clicking is the gas escaping. Sometimes we can have some clicking in the kneecap specifically because of the tracking of the kneecap, but it doesn't necessarily mean that there's more pathology happening. We would focus a little bit more on the pain there. And doing exercises, you might get clicking because there's muscle imbalances, and the whole point of doing the exercises is trying to correct those. So it's all case by case, but I would say generally clicking does not necessarily mean more damage. Anything to add on that one, Mike or Diana?
No, I agree with you.
Okay, yeah, awesome. I saw another question about if thumb arthritis can be affected by GLAD, but Diana, do you want to take that one?
Yeah, so the GLAD program right now, we just have a GLAD program for hip and knee. There is a GLAD back that will be coming out shortly. It's a pilot program in Alberta right now, but from what I understand, there's just GLAD for hip and knee osteoarthritis at the moment.
Okay.
I'll address a couple other questions here. Allison put in, is the program just given in your Bradford office? No, we've got, Diana's working throughout Bradford, Aurora, and Nobleton, and there are classes starting to fill up now with participants, and there's a variety of options, Allison. So whether it's virtually or in person, we can, coordinate all that based on the needs of everyone looking for classes. Carol writes here, is this a program one should attend before surgery? Diana, what's the stipulation around that on the surgery stuff?
Typically, if you're 6 months waiting for surgery, generally you're not supposed to participate in the GLAD program just because you won't have that much time to, for your joint to adapt and make the change. We're generally looking at, that patient that's a year to 2 years out from surgery. That's our best candidate for GLAD. But I mean, between that year to 6 months before, we are open to having you join the program. What were you going to say?
I would say that, if they can't join the GLAD program because they may not get the results that GLAD is wanting, coming to see a physiotherapist for what we would consider prehab is a really good idea, because the stronger you go into your surgery, the stronger you'll come out of it. So the more strength you have going into it, the better your recovery will be. So if it's not through the GLAD program, you can still get a variety of these similar exercises from a physiotherapist.
Yeah, that would definitely be a good option if you're going to be having surgery soon.
For sure. We definitely recommend that.
Yeah.
I'm going to kind of keep going through some questions here because we're getting lots of great questions. So everyone, that's great. Can you play squash with a knee brace? Absolutely.
Yes.
Layla. I've got people from dog trainers to bowlers to tennis players that use these things. So yes, you can play your sports with the brace. That's why they're there. How soon can you set up an appointment? Is there a waiting list? We can get you in as soon as possible. I think Simon wrote that. You know, we're just sorting out all the availability. There's another question here. I think Arlene, who does assessments for bracing? You're looking at her. Diana is takes care of a lot of the custom bracing and other bracing options. So you can, again, we can definitely write your name down and reach out to you, Arlene. I'm just coming through here a little bit more. So GLAD's not available for the base of the thumb. No, this is, again, as Diana mentioned, it's for hip and knee arthritis. That's where it's been clinically proven and tested. So that's why it's specific to those joints.
But physio can help for
sure.
Lots of exercises we can do.
Yeah, we've treated the base of the thumb all the time there, Joanne. It's a common spot for arthritis for sure. Kirk wrote, do you see a lot of recurring or lifelong patients using the GLAD program, or is the program meant to be used once or only when necessary? Go ahead, Dinah, you want to mention?
Yes. So with the GLAD program, because currently it is a data analysis, what they're doing, you can only enter the GLAD program once, and generally the exercises are good for both hip and the knee, but we tend to just do the program for the most affected joint. They actually, I just got an email today from GLAD. They are doing a maintenance program, which they just started to implement today. So it's an 8-week maintenance program for participants that have already completed the GLAD program and want to continue that guided exercise.
And the goal would be for people to stay healthy and active and doing their exercises for life, right?
Yeah, that's the whole principle around it, is having that lifelong learning of doing proper joint exercises.
Another question here, how soon post-surgery for meniscal cartilage tear can you start it? Obviously, as soon as you've rehabbed that particular injury, Cheryl, you could get going on starting something like this, as long as your knee is recovered from that surgical procedure. Let's see here. Sherry is using an Oster brace, and sounds like it's going well. And the question here from Maureen, is the program covered under PT benefit plans? So it's run by Diana, who's a registered kinesiologist. Most health benefit plans will have coverage. They are regulated health professionals, so there's likely a sort of a set amount of dollars that can be used for a variety of resources, and registered kinesiologists are included in that. So you can certainly contact your insurance company to verify, but this would be billed as under a registered kinesiologist. Okay. Lovey, we'll send you some details if we'll get you some GLAD details, because I know you have some questions about what's included. So I think most of the questions, if we haven't gotten to all your questions, just for the sake of time, folks, you know, we're trying to keep this to about an hour. They're all typed into the chat. I will save the chat, and then we'll address them. If we haven't addressed the question already tonight, we'll certainly reach out to you and make sure you get the answers that you're looking for. I think moving on here, Steph, just to go over a little bit more here, you can certainly reach out, email Stephanie or Diana. There's their emails there. You can go to our website. It's bradfordsportsmed.com, and you'll be able to find the details for Diana and Stephanie there as well. Again, as I mentioned earlier, if you want more info, type into the chat and we'll get that to you. Let's get to the, what do you think we should get to the prize giveaway now? Oh, wait, hang on.
One more thing.
One more thing, folks. We had a few people asking about osteopenia, osteoporosis, and actually it was really great they asked about, because this is, Diana is why don't you just touch on this? You're going to do another webinar next month because this is the next sort of
Next big
topic,
thing.
right?
Yes, so I've developed a program to help patients that have osteoporosis or osteopenia. It's exercise-based therapy that we do to help support the spine and reduce, our risks of falling and any other of the negative effects of osteoporosis and reduce risks of fracture. So please send me an email below. My email is listed there if you want more information, or also just type it in the chat as well. But do stay tuned for our webinar for March because we'll be going into osteopro there.
Awesome.
That's
We're
awesome.
excited.
Yes, it's an amazing program. Diana has done a bunch of training here with Osteoporosis Canada. It's a bone fit program, so it's a really amazing program, and I think a lot of people certainly would benefit.
Yeah.
Okay,
Yeah.
so Steph, if you could cancel
Yeah.
there. Okay, I'm going to share
I'm
my
ready.
screen, and as everyone who knows me, who's done these webinars, I put everyone's name in. We had a lot of people attend tonight, so I'm going to spin this wheel, and hopefully that person's name who turns up is here tonight. And if not, then they're going to have a few seconds to respond, yes, I'm here. And if not, then hey, guess what, we're moving on. So we're going to spin it again. Okay, so Dinah, what's the prize for tonight? Let's talk.
Tonight you actually get a little exercise starter kit. So we have some sliders and some bands that you'll get to go home with, and you just let us know what clinic is closest for you to pick them up at, and we'll make sure they're there for you.
Yeah.
Okay.
We'll reach out to the winner and we'll coordinate that. But that's a great way to get started on some exercise. So without further ado, I'm going to spin this wheel here and see what we get.
Drum roll, please.
Yeah, and if you guys can have a look on the chat and see if your name pops up, is Lynn Wisniak, is she on this tonight?
Lynn, let me see.
Lynn, if you're here, just say I'm here in the chat. Is Lynn here?
Looks like she's still logged in.
Hang on, is she? No. We're just checking.
We're checking.
Lynn.
Hang on, I'm gonna just look
I see
here.
she's here.
Lynn, are you here?
One new message.
Yeah, Lynn, I see you here. Yeah, Rita, you're on there. Don't worry, I got everyone's name on there. Okay, Lynn, I know you're on because I could see you're on the attendee list here. So congrats, Lynn. We're going to reach out to you and we'll provide that prize to you. Amazing. So in closing, I'm going to just stop share on mine. Steph, you can pull up yours again.
Oh, okay.
Everyone, just once again, listen, thanks for attending tonight. We really had a great evening. I thought this went well. I loved all the questions everyone provided. So thank you all for coming tonight. Stay tuned for the OsteoPro webinar coming up with Diana. We're just super excited to offer as much info and help as we can out there. So enjoy the rest of your evening, everyone. Be safe tomorrow. Don't worry about the snow. We live in Canada. We're okay.
All
right, folks. Everyone,
Thank
thank you so much and have a great night.
Yeah, good night.
Take care, everybody. Bye.
Bye.